All right. Hello, everybody. We're excited as representatives and hosts of Lumate to bring you something from our company, but also collaborating with CBT therapists across the world. So today we're going to be talking about teens. Lumate is a company that really focuses on teen mental health. So we'll be talking about helping teens manage anxiety in the age of uncertainty. I'm Sarah Olivo. I'm the head of Lumate Academy, and I'll let my co-host introduce herself.
Hi, everyone. Yes, just so excited to be here. So I'm Muniya Khanna. I am Chief Digital Officer at Lumate, working with Sarah, and we are excited to talk to you about teen mental health and about Lumate.
So, when we think about original, sort of go back to your own teenagehood and consider some of the worries we have. Adolescence can be a time of a lot of strife. There's a lot already on your mind. So there's how you perform, there's relationships, there's potentially peer pressure to engage in drinking, smoking, etc., drugs, there's grades, body image, the ever looming driver's test. And those things still exist today.
I think the other thing that we often talk about these days is how much those things are exacerbated by the constant ongoing kind of check that happens on social media. And so the internet and social media really has sort of, I think, made everything exponentially more intense and it's sort of a more constant worry. So these were all topics that we would imagine they would be worrying about, but it's the amount of times during the day and the amount of checking during the day on all of these fronts might be just much more intense than what we can imagine.
Exactly. There's so many sort of pings that you get throughout the day.
Yeah.
And the other thing is, I was looking, and actually, Muniya, you had let me know about this, the Surgeon General's advisory on adolescent mental health. And I was looking at factors that can shape the mental health of young people. And if you see, there's, some of those original things like the individual worries that can happen, worries in the family, what's happening in your community. So not only is social media giving you more hits in those categories, but it's also expanding worries to where there's a lot more awareness about things that are in the greater environment and also societal worries. So we have people who suddenly have access to information at much greater rates and at much greater, intensity than they did before.
Yeah.
So I go ahead,
I
Minia.
was just going to say, I think they did such a good job with this report. The Surgeon General's report, I recommend anyone who has 5 minutes to go to Surgeon General. I think we might be able to even link to that website. They've done a great job in summarizing the issue with teen mental health. I'm really glad, I think we all are, that the teen mental health crisis is at top of the list of things to address by our Surgeon General right now. Vivek Murthy's done a great job of raising the issue and making some real, clear goals for what everyone can do at every level. So he's talking about what communities can do, what organizations can do, what even medical healthcare professionals can do, and then what parents can do, and what people working with teens in schools and in everyday life can do at every level. So I think it's a wonderful thing that's happened. It's a great start point for any organizations that are looking to see what they can do. So I recommend everybody kind of hop onto this website. But again, to underline what you're saying, I couldn't agree more. Not only are there new challenges that they're facing, like climate change, cyberbullying, in a way that we hadn't, had to cyberbullying wasn't an issue when we were growing up as teens. The sort of really, real danger of threat of climate change, political instability, school shootings. These are all real dangers, but then add the number of times they're getting notifications, updates, news just being pushed to them about all of these things. So just the intensity of how all of this is getting experienced, I think, is just no surprise that our teens are struggling. So, but yes, I'm glad that we are part of the solution to some of
Right.
this.
Yeah, no, it's been sort of invigorating and refreshing to have the Surgeon General talk about
Yes.
mental health as part of the platform.
Yep.
And so if you look at recent surveys of worry in youth, you see that our assumptions about, whoa, they have all this access are really being backed up about look at some of the things they're worrying about. Climate change, technology, yes, they like it, but also it brings them stress.
Mm-hmm.
Political issues, school, all the things that you just mentioned, Muniya. And look, the same old
Mm-hmm.
story, the future, getting into college,
Yep.
being accepted by others and school achievement. So they're still worried about those original things that I think have shown the test of time in terms of adolescent worry.
Mm-hmm.
And they have this other aspect
Mm-hmm.
on top of it to add to it. So
And we didn't really touch on the pandemic issue.
oh, I think I'm trying to block it out.
I think in a lot of ways, because we are back to work, back to school. The communication about what happened to our kids have changed again back to some of the sort of more extreme, more like the things they're struggling with on a immediate basis. But I think the pandemic really taught us a lot about how much support our kids need right now, and that there was a big we did see a big increase in how much worry and social anxiety and isolation and withdrawal and low mood was exacerbated during the COVID crisis, and that we're still trying to help many kids get back to baseline, and milestones were missed, and so we're still there where we're supporting our teens and getting back to baseline on those issues as well.
Yeah, I think that the trajectory was going towards more angst anyway, and the pandemic didn't help.
Yeah.
I think yes, to your point, a silver lining is that more people are saying, "Oh, okay, let's actually pay attention to something that was already there and now just grown." But as you can see from this slide, approximately 20 or 12 to 20% of teenagers struggle with severe anxiety, so not just your basic teen angst. And that statistic, goodness, is growing at a rate of 29%. And then, as someone who, Muniya and I both practice and see clients and see patients in the teen years. And so I don't know about you, Muniya, but I'm getting calls all the time and saying, I can't take them. I can't take them. And it's a big reason why I ended up joining Lumate, because I feel like I needed to do something because so many teens aren't getting treatment.
Yeah, that's exactly right. We've always been focused on getting access to care out there, and now that we're seeing, the rate of it's prevalence rates, but it's also the rate of people reaching out for help, which is a wonderful thing. It is a silver lining that our kids are feeling more comfortable talking to adults about mental health, and adults are being more proactive today than maybe we were when generations prior to reaching out for support. So that's a really great thing that's happened in the last several years. But the bandwidth of people being able to see these teens in need, and also just access, people in rural communities, people who are outside of areas where there's a lot of university settings where there might be hospitals with mental health care clinics, specialty clinics, and community clinics with mental health support options. Once you get outside of some of those city urban areas, it gets harder and harder to access care. And exactly what you said, it's one of the main reasons I joined Lumate, even though we've done so much, in terms of learning about what treatments are available, cognitive behavioral therapy, which is the CBT that we're talking about here today, that we've learned so much that it helps and that it's effective in supporting teens with anxiety and with other conditions, although we've been focused on anxiety, but CBT's been very helpful for other conditions as well. And having access to quality CBT is really tough. It's access to not just professionals, but professionals who have training in evidence-based care. And it just felt that even though we felt like, oh, how great, we've come so far in being able to evaluate treatments and seeing that these treatments are effective, we still can't reach all the people we need to reach. And that struggle's been going on for most of my career. That was my mission, and I think yours too, when we started.
Mm-hmm.
And now that we this was what drove us to starting and joining Lumate, that Lumate was a way that we could really spread expert care nationally and reach all of those kids who need access to CBT, to effective CBT that's being offered by trained professionals. And so, yeah, here's a great slide. I think it talks a lot about what we're doing at Lumate, and why we think this is sort of the gold standard, is the way we've talked about it. Gold standard just means that all of the research that we've done over the years, they've come up with conclusions about what's effective, how to be most efficient, how to address the needs of multiple populations. And so we're using the best of the results of all of that work and putting it into this package of CBT that we're offering at Lumate, that we are so proud to be able to do, in terms of being able to control the quality of care and really know that everyone who calls, I used to say that one of the main problems with psychotherapy as a field is that somebody, a parent or a child who's looking for services in the community, could go to one clinic, Clinic A, and get one type of treatment, and go to Clinic B and get something else, and go to Clinic C, and it was really impossible to know, am I talking to the right person? Am I getting the best care? Am I getting the treatment that's most effective for what I'm struggling with? So it's so hard to know, am I getting the best quality care, and am I getting the right care? And what we're doing is we're making the question, easier to answer. If you're working with someone at Lumate, you're getting the treatment that's most effective, shown to be effective for teens with anxiety, and you're getting someone who is truly trained and expert, and also being supported by experts to be able to deliver the best quality care. So I'm really proud about that. That was always the mission, and that we're putting a dent and getting there is really exciting. And maybe you want to tell us about some of the other squares here, but I think that's the one that excites me the most.
Well, I know I was thrilled to jump on board with the team, and I, like you, had felt like not only just in Clinic A versus Clinic B, but teletherapy service A versus teletherapy
Yeah.
service B, you could have a lot of different experiences. And I just, a lot of friends or other people who aren't in the psychology field will say, well, isn't all therapy good therapy? And I was like, well, no, not really. I think that's sometimes a myth that people fall into, which is just, well, all therapists are nice and kind, and isn't that good?
Mhm.
And yes, I assume that can be true, but it really is important to pay attention to the type of training and the type of treatment you're getting, because sometimes therapists can do harm without even meaning to, because they're just not catching something early, or they're not able to manage an anxiety symptom that has a solution, has a coping skill. If they don't know how to teach that coping skill, then that person's not getting better, and not getting better quickly enough. So I think I'm so excited to talk a lot more about some of the technology tools we have. Maybe when we think about further on the slides down the road, we're going to be talking about exposure. And I think it could be really cool to think about how Lumate is going to manage that piece, because that's really exciting.
Yeah.
Um,
On the technology side, I can say, that's the part where I feel most connected. It's been one of my research interests. It's been one of the things I've spent the most time developing and studying. What we're wanting to do is, we're doing telehealth, which means that our office is this screen, and we want to have, um, it's not just to communicate, it's to engage our patients is our job. And how do we engage our teens who are sitting in a different room? And how do we engage them in doing practices when we're not sitting in the same room and can't walk with them to the Starbucks or to the local mall? How are we going to make exposures work? This is the opportunity, I would call it, not the challenge. It's the opportunity for technology to really be a major driver in how we close the gap in that question. We're researching. We have for many years researched the benefits of mobile apps and of tracking, and VR is one of the things I'm most excited about. I really think VR, virtual reality, is going to change the game when it comes to treatments for anxiety in particular, but other conditions as well. And Lumate and our team at Lumate is spending a lot of time researching and developing these tools that are going to make our telemental health offerings much more powerful, much more engaging, and actually, I think of it as actually an opportunity to get to support our teens throughout the week, not just as a 1 hour, once a week model of care anymore. This is, expert care, ongoing support, ongoing practice, a real lifestyle change with the support of the technology tools. So I'm really excited about that. And yes, you're right. We'll talk about it more as we go through the slides, but the exposure part and the VR part on that is just, it's going to be incredible.
Yeah, no, I'm really excited. I've certainly had a lot of times where I've been limited in my ability to get the right exposure because I can't create, an
Right,
airplane in my office or a
exactly.
cat or a barking dog in my office or
Or
a group of
cafeteria. Yeah,
angry
exactly.
teens.
Exactly.
So,
Yeah.
but I really get excited about the thought leadership that's at Lumate as well. So the people who wrote the books on how to treat anxiety in children and in teens and young adults are the ones who are at the core of creating this treatment. So you know right away that you're going to be in good hands. And this is just a sampling of some of the literature and bibliotherapy that's out there from the core clinical and tech team. Hi, Grandma.
Really. I, I, I quit. I even took down my, anyway, sorry about that.
She wants to know.
I
She knew your
know.
book was up and she was going to say she's so
We
proud of
talk about
you.
this really well. Yeah, this particular slide would be her favorite for sure.
All right. So now getting a bit more into the nitty gritty, what are some of the things for a teen who comes into Lumate? What might be some of the skills or education they could get about it? But as you saw before in some of the first slides, so much of what teens have to worry about is really out of our control, out of their control. And I'm sure anyone listening here knows what we're talking about. Other people's actions, what they think of you, sort of our initial instinctive automatic thoughts and reactions aren't in our control. Our memories or the past, the fact that time marches on and what's going to happen in the future. These are things that there's not a lot of problem solving for. They're just things that we are I don't want to say victim to, but we have to
Mhm.
tolerate the fact that these things aren't in our control. If you think about what is in our control, how do I respond to people? How do I respond to my emotions or thoughts once I have them? What do I do? How do I act? What do I do with my hands? What do I say? And the great thing about that is cognitive behavioral therapy or CBT is the therapy that is best able to teach you about some of your responses, to teach you about emotions, what it's trying to tell you, and maybe when it's giving you some false alarms, it's sharing what ways you can act or what ways you can consider or reconsider the thoughts that your mind is feeding to you. So that I think is what's really great about CBT is that it allows for it allows you to say, okay, there are things that are uncertain in this world, but how can I manage that?
Yeah, exactly. I think CBT gets oversimplified online often. And so that's another reason I'm so glad that we're doing this talk and we'll continue to be offering these types of presentations. The idea that all CBT does is to help people to think about things in a different way and be more positive, I think is sort of a myth that's out there. What else could, what's another way to think of this, and hey, maybe there's a more positive way to think about that. And really, I CBT, the cognitive training or the cognitive support that we're offering is more about building awareness about how we're thinking. It's not just to say, oh, is there a better way to, what's the evidence I have for that? That's always the one everybody sort of notes when you Google search CBT, the first thing that pops up, or now it's going to be Chat GPT, but when you go on Chat GPT and ask, what's CBT, there it's going to say, oh, it's going to, with a therapist, you will be able to challenge how accurate your thoughts are. And what we do is we build awareness of the thoughts. And this is such a great, this slide, the out of control and in our control difference makes such a difference in what you do next. You can, with awareness of this dichotomy, you can sort of say, okay, there are things I can do. There are things I'm thinking about that are out of my control, and there are things I'm thinking about that are in my control, and my actions should be, and my attention can be focused on the things in my control. It'll be so much more useful to me. That's
Right.
not just saying, hey, what's an alternative thought? This is building awareness of the thinking process, and we're helping build awareness of the anxiety process. This is helping building awareness of what's happening as we're worrying, and then making a decision about, okay, what can I do? What do I have in my control, and what do I have to leave, out here, and try to direct my attention to the things I can do something about.
Yeah, so beautifully said.
And I think that sometimes we are, again, we sort of oversimplify CBT as just talking about thinking about things differently, but we've been really clear, I think, from the beginning in terms of our model of work at Lumate, is that is the thing that helps us understand why we need to do what we need to do. But the practice of doing the what we call exposure, or doing the behavioral practice of doing things differently, approaching instead of avoiding, is kind of, if we think about the key ingredients, it's not that they're three equal slices necessarily. It's that the slice of understanding and building awareness supports, the major slice of need, helping us retrain our mind and body by doing things over and over again and practicing using those skills in the exposure piece.
Right. So we know that CBT, we can just go through this quickly,
Yeah,
but essentially it's been vetted, right? It's
yeah,
been vetted. It's
right.
been around for years. It has so much research to show that it's more effective, not effective, but more effective than other psychological therapies. And it gives you, to your point, Minia, you said this a lot, it's education about your emotions. It's collaborative. So you and your therapist are working together to try to understand this. And sometimes with your parents, if that's with the parents or the guardians, if that's relevant.
Mhm.
It gives you insight to your thoughts that are keeping you stuck,
Right.
and it guides you towards actions and behaviors or ways to respond to those thoughts that free you up from your worry and fear. At times when it's feasible and there are things you can problem solve, it teaches you how to problem solve in a really structured way. And then it gives you coping skills for when you have those, uncertain thoughts. So, or when you have those thoughts that are around things that are out of your control. So, the brief CBT model, and we'll go through this somewhat quickly because there's a good chance that if you're listening that you know some of the basics, but the CBT model says we want to look at our thoughts, how our mind gives us information, what narrative it's telling us. We want to look at the physical feelings that come with that, kind of what is the body alarm that's happening. If it's sad, sometimes that's kind of feeling heavy. If it's anxiety, it's feeling a bit more amped up, the heart racing, et cetera. And then what are our actions or behaviors? What are we doing in reaction to these things? So this is a typical example of how that can happen. So now we're looking at those three things in action. And it can really start. I know we have 1, 2, 3, and 4 here, but
Mhm.
oftentimes it can start in a number of different places. But very commonly, especially when we're thinking about uncertainty, you have a what if thought that pops up. What if the environment never, the environmental issue or climate change never improves? And then you can imagine your body alarm goes off. Maybe you get a tight stomach or your heart starts to race or you start to feel a little hot. So that's your body saying, ooh, this is important. Think about this. And then you avoid the things you worried about, or in fact, sometimes with uncertainty you avoid it, or you just ruminate. You sort of chew and chew and chew on the thought. You think about it over and over again, or maybe it's almost twofold. Either you might, when you're worried or anxious, you might just think about it and think about it, think about it. You can't change the channel, or you say, that's too big for me. I'm going to go watch Netflix and just ignore it completely.
Right.
And then whatever happens, you feel better. Maybe if you're ruminating, you're thinking, oh, I'm really problem solving the climate change issue. So I got to think about it
Yep.
because I'm a good person.
Right.
Or you watch Netflix and you're like, oh, that was a great show. Now I've completely avoided it.
Yeah.
But your brain learns to deal with that what if thought in those ways, neither of which actually takes the what if thought away or reduces it in
Right.
any way.
Right. Yeah, this side is so central to everything we do in the treatment, because what we try to do for the teens is make them really aware of the cycle, so that they know all the different things that are happening. And when you can see it, when you sort of know it's coming, it's a lot easier to feel like there's something you can do about it. So we really, in that time that we're building awareness, we teach about this cycle. We help them to really pinpoint what their frequent flyer what if thoughts are. It makes it even faster and easier to know what's coming. And then they get to get really expert in knowing what are the usual, what are my go-to things that I always feel like help me feel better. And then decide, are they helping me feel better temporarily and actually making me feel worse long term? Or was that a good coping strategy? Was that something that really worked for me, and should I keep doing it? And so then they get to now play with the cycle, and they can decide, where do I want to break this cycle? And then we help them practice it. So this is really central. I use this cycle all the time. Even
Yeah.
just talking about what we want to focus on and what's happening that week, it just keeps things really clear. And it also makes it feel like, it's not that there's something wrong with you. I think this is one of the other myths that make me really upset about mental health. There's sort of a black and white thinking that there are people who are mentally well and there are people who are mentally unwell, and that people who have mental health issues need therapy. It's not a black and white issue. We are all on a continuum of mental well-being, and whenever we get caught in a cycle where our body has given us an alarm, it's in, again, we're all built in with the same alarm system. That alarm system is going to kick off from time to time, and if we are learning sort of to, as we address the environment or as we approach or avoid, we're going to actually create cycles that can make things worse or make things better. And we're all in this together. We have to support each other. That's another lesson we learned during COVID, that all of us saw that we could struggle when you are removed from support, when you're removed from physical exercise, when you're removed from structure and from positive reinforcement from friends and family. You feel mentally not well. And
Yeah.
so all of what we're doing is we're trying to show through our work with our teens and our families, our parents too, let's see this cycle. Where are we? And it's not that this thought is something wrong you thought. It's just something that's been getting stuck, and
Yeah.
we figured out a coping strategy that's not quite working. It's making this pop up more than we want it to. Let's try to fade it, and let's try to see what we want to do to make it stop coming as often as it has been. So
Yeah.
we're all in it together, parents, children, teens, schools, mental health professionals. We are here as supports to help build this awareness. Um, and I'm so excited that ABCT has been helping us to sort of spread the word on this.
Yes, exactly. So we will potentially be coming back with a few more specifics around coping skills. And what we just wanted to get started by sharing some of our thoughts around how the anxiety cycle works, and what I think it simplifies something that can often feel complicated, and it gives you a roadmap. This next piece, we don't want to pretend like we're going to be giving you a lot of information pretty quickly, but we wanted to give you a window into some of the things that that at least I often, or the Lumate clinicians, will be considering when working with an anxious teen, especially when it comes to things that are, that kind of uncertainty piece. When people are anxious, oftentimes that means they're having trouble tolerating uncertainty. And so they use worry in a way that they think might be effective, that rumination piece I talked about before. So some of the common myths about worry is that it's problem solving, like, oh, if I'm thinking about it, I'm helping with the solution. that it's a motivator. If I'm not worried about this test, then I won't study and I won't fail. Um, I won't study and I'll fail it. That it saves me from other bad emotions. So this is the sort of, if I think about my boyfriend breaking up with me, then I'll be really prepared
Mhm.
if he does.
Mhm.
Then there's the superstitious piece. If I really worry about the plane crashing, then I'm kind of doing my part to keep it from crashing. Like I kind of just got to go through the ritual
Mhm.
of worrying about it. I might have been a little victim to this in my teen years. And then last but not least, if I worry, it means I'm a good person.
Yeah.
And so if I don't worry, I'm callous. And we won't go into the nitty gritty just because of time, but the truth is that these are myths about worry. And then in fact, you can problem solve, be motivated, etc., without having to worry. We can pull that worry piece off. And when you think about worry, there are two types. Again, we're trying to take something that feels complicated and turn it into something a little more simple. So there's two types. There's actual worry and there's hypothetical worry. So, actual worry is when something is in front of you and it's happening in this moment. There's a problem that needs to be solved. And so, that skill set starts with problem solving, or, and we'll talk about this part in a little bit, engaging in active coping behaviors or approach behaviors. That's where, with anxiety, you might think, okay, so you have this actual problem, which is that you can't get into the classroom because you're scared of this presentation. How are we going to learn over time to approach that situation so that you can get the grade you want or get the class present, participation score you want, etc. And then and hypothetical worry is a little bit more of those what if thoughts. What if I fail the test? What if I don't get into college? And there's not a lot you can do about and so some people, for instance, might say, well, the test is coming up, that's an actual problem. And I say, okay, but if you're like in a coffee shop talking to your friend and all you're doing is fretting about this test and talking about how you're going to fail it, like, is that in that moment a problem that you can solve? Not while you're in a coffee shop with your friend. So in that moment, it's hypothetical. If you're in your dorm room and you have a test coming up the next day and it's an actual problem, then in that space and in that time, you can problem solve. But it's not helpful when you're hanging out with your friends just fretting about the mean professor.
Mhm.
So the reason you want to know the two differences are because depending on what it is, whether it's actual or hypothetical, you're going to engage in a different set of coping skills. And so here are a few that you might do for a hypothetical worry, which is to try to challenge the thoughts, come up with a way to consider all the evidence and weigh it a bit more logically, to engage in some mindfulness, meaning, okay, wow, I'm really notice I'm anxious about this test and I can sort of see me wanting to talk about it a lot, but I can just notice that without necessarily having to get stuck on that thought. I can just let it go. Or set aside a time or a space to worry, which is similar to what I said, where it's like, okay, I'm worried about this test now in this cafe, but I can't do anything about it now. I know that I can problem solve tonight when I'm in my dorm or later when I go to the library. Then that's the time for me to start engaging in the steps I need to take, but not here, not when I'm in the shower. Like that's just not the helpful time. I don't know. Muniya, do you have any examples?
And middle of the night is a big
Oh,
one.
yeah.
And I think what's also really interesting is, the slide before. I love that slide. I actually am going to steal it for future presentations from you. So worry is one of those things when once that cycle builds over time, it becomes very much a habit. And that's one of the
Mm-hmm.
things, again, we try to build awareness about that you're worrying. Sometimes we're worrying just out of habit. And if we've built that habit, it's really interesting. But when when you notice that you're not worrying, it feels really uncomfortable. So then you have to sort of jump back in to, scanning for danger, because it's like, I just had this moment where I'm not worried about anything. Oh, something bad must be, it's going to happen.
Right,
I,
right. They're like, what's wrong?
what happened? Like, I just lost my opportunity to prevent something bad from happening.
Yeah, yeah.
So I think that was so great. And here what you're doing is you're offering a next step. Now that you've
Mm-hmm.
noticed that you're in this cycle, here's what to do. Usually the worrying about the worry ends up helping us feel better temporarily, but not long term.
Yeah.
That was that's where we sometimes, that's why we would say that we're stuck, and we're worrying all the time. This is like how to get unstuck from that, and then just kind of making a distinction between, is this something I need to address right now, or am I worrying in a way that's time to just reassess, like, what was that thought? Wait, do I need to handle this right now, like you said? And
Hmm.
so absolutely, like, how it's sort of the, like, what to do next part of noticing that you're in one of those worry cycles.
Right, right. So we talked a little bit already about some of the hypotheticals, but I thought this was just a fun graphic to think about. Before CBT for
Yeah.
anxiety, typically the actions you're engaging in are avoidant in some way. And after CBT for anxiety, we're going to talk more about how do you approach things that you fear? How do you approach things in a way that feels more like you? And we could do a whole, I mean, Minnie, I'm sure you could too, like a whole presentation on just exposure alone. But just to sort of, I guess, highlight that a big piece of what we'd be doing at Lumate is to say, okay, what are the things that you're avoiding because of your anxiety, where you end up, because you avoid it, it feels better in the short term, but it maintains your anxiety over the long term. And if we practice repeatedly sticking it out, managing that anxiety, then over time, it no longer controls you. And this is where that virtual reality piece got really exciting for me. I was just thinking about a teenager I was seeing in my private practice, and she had social anxiety. And we couldn't find a group for her. There just wasn't running at the time. And a lot of times, teens are like, over my dead body, am I doing a group? So trying to come up with various ways to get her in a place where she had to face her anxiety in my office, just with me, whom she was very comfortable with. There were only so many practices we could do. I could only come out, go down the avenue, like make a fool of myself, and then ask her to make a fool. It's like at a certain point, she needed to be around people her own age. And I let the mom know. I was like, all right, like Lumate would be such a great place for her to come, because there will be virtual reality platforms so that she could engage in some of this stuff that is really at the crux of her anxiety, which is being judged by a group of her peers. So,
Right. No,
yeah.
exactly. So the virtual reality option is so great because of exactly that. It's one of those things where what we're doing is we're creating several environments where our patients, our teens, are going to be able to sort of, virtual world experience the panic peaks in a safe, controlled way, and then be able to practice their coping strategies and practice that approach of the challenge, which we've learned, just choosing to do the approach helps with reducing anxiety so much. So the more they do it, they're going to notice that, oh, this is getting easier and easier, and then be in a position to practice on their own without support in real world settings, and be able to come back and create even more challenging situations. So we're doing it in a controlled, safe environment with the support of a therapist in a way they can do it at home without needing to find a ride to get to a roller coaster, or
Right.
or like you were saying, just somewhere easy, like going to a store to get something, pick up a coffee. That we can do this all now at our desks, and then be able to experience the same benefit over time. Again, retraining our body, we think of it that way. We think of it as changing, sort of, you're having the experience of doing it different, makes it that the next time you're in that situation, your experience of that changes. So as you continue to do these practices, your whole experience of the situation changes. And it's one of those things, I always ask people when I'm kind of describing how powerful this is. I tell people, just close your eyes and picture the best pizza, the best cheese pizza you've ever had, and what was it smelling like? What did it look like? And then you can notice, like, within seconds, your mouth is salivating. It's
Mm-hmm.
because our brain is, in our case, this is like good for us, but not great when we're worrying. It's good for VR though, where our brain doesn't really know the difference between what we're seeing in our mind and experiencing very well. And so we can actually relearn things by just, being in the virtual environment as powerfully as being in the real environment. And we're taking advantage of that little brain trick that we have. So again, super exciting, and I can't wait to tell people about it more.
Yeah, me too. And we'll end on that exciting note. So, thank you all for joining us. Please go check out Lumate Health and read a little bit more about what we do and some of the founders and their work. It's all so impressive. And we can't wait to hear from you. Reach out and let us know what you think.
Thanks, Sarah.